And Michigan Governor Gretchen Whitmer joined Nevada and New York and literally are threatening doctors and pharmacists in the state who prescribe and dispense hydroxychloroquine to treat COVID-19. Dr. Smith is using hydroxy and azithromycin on some of his patients. Now, prescribing hydroxychloroquine or chloroquine without further proof of efficacy for treating COVID-19 will be evaluated and may be further investigated for administrative action. Ooh, joining me now, Dr. Jeff Collier, former Kansas governor and chair of the National Advisory Committee on Rural Health and Human Services. Dr. Collier, these governors seem to be still reacting to that one story out of Arizona where the guy ate had the aquarium cleaner, and that was a tragic death for him. But is this off-label use hurting or helping patients?
You know, off-label use is extremely common. 21%, according to Johns Hopkins magazine. Johns Hopkins estimate 21% of people of prescriptions nationally are off-label uses. Doctors do this regularly. And this is an instance where we have some data, but it is our only option there. And I think if you work with your doctor and your doctor prescribes this, then I think that's a reasonable plan. But you need to have a plan with your physician.
But threatening pharmacists, I guess, with license revocation, or threatening doctors who are already under such incredible strain with administrative action. I mean, you better be lucky you have the doctors you have. Boston has 150 healthcare workers infected. And this is how they treat them. And many of them are reporting to us positive results with hydroxy and zithro. This is insane.
You know, one of the things that would actually be a very good idea is that in this emergency, you should drop risks of malpractice or other things against licensed physicians. We need those bodies out there. We need people to take care of patients, see them, listen to them. And they're on the front lines. They're putting their own lives at risk.
Dr. Fauci addressed this question today. I've asked him about it specifically, and he doesn't dismiss the potential completely of these antivirals, but he wants to wait for all the bows to be tied. Watch.
The best way to get the best drug as quickly as possible is to do a randomized controlled trial so that you know, is it safe and is it effective?
Doctor, isn't this a wartime situation, though? I mean, ideally, you want a controlled, randomized study, but right? This is wartime. Yeah. You use the bandages you have.
Yeah, exactly. You go to war with the team that you have, with the soldiers that you have, but you're also going to be building additional planes and tanks for it. In this instance, we have a drug that is very safe. It started in 1955, has been used throughout the last 60 years, has been widely used, has a very good safety profile. So the safety part of it is minimal. We're using it only for 5 days. The efficacy of this is, yes, I would love to be out here.
Yeah, we'll get it later. Yeah, we'll get it later. Governor, I got to ask you one more question. Cuomo, Governor Cuomo's under an enormous amount of strain, obviously. It's a horrific situation unfolding in his state. But he said this about how the state's experience will become America's in general. Watch.
Almost any scenario that is realistic will overwhelm the capacity of the current healthcare system. Keep the curve down as... New York is the canary in the coal mine. New York is going first. We have the highest and the fastest rate of infection. And that's how the nation should look at it. Look at us today. Where we are today, you will be in 3 weeks or 4 weeks or 5 weeks or 6 weeks. We are your future.
Is that the case? Is New York's example, which is horrific, going to be the same for Kansas City and Denver and Scottsdale, Dr. Collier?
No, every region is different. And here's the thing is, we all get smarter as this goes on. And that's part of the ingenuity of Americans. And how we deal with it is very important. You know, we're fighting for our patients. The president's fighting for our patients. All of us are. And we as Americans, we are getting together. We are looking at this. You know, and one of the things is, yeah, we're going to help our neighbors in New York, but we're going to take care of our own here. And I see all sorts of interesting things happening here in our community. Things like moving more medical students out to help the community out in rural areas, taking care of specific problems. Yeah. You know, we've got a lot of answers, and we're going to do it.
Yeah, but the idea that a highly congested city like New York, it's going to be the same in Topeka or Bend, Oregon, that just doesn't quite add up. Dr. Collier, thank you very much for joining us tonight.